Good morning to everyone. I am Dr. Sagarika Mahapatro, consultant neurologist at SCPM Super Speciality Hospital, Gonda. Today we will discuss about what is epilepsy and seizure, and we will address one of the most important questions that often patients ask me: how do I know if I have epilepsy? So first, what is a seizure? Seizure is a transient occurrence of signs and symptoms that occur due to abnormal, excessive and synchronous neuronal activity of the brain. Depending upon the distribution of this neuronal activity, the seizure can be so dramatic convulsive activity, or it may be a very subtle phenomenon such as transient numbness of the part of the body, abnormal sensation of one part of the body, focal twitching of the face like this. And on the other hand, epilepsy is a condition where a patient is having risk of recurrent seizure due to a chronic underlying condition. In the year 2017, the International League Against Epilepsy, that is ILAE, classified seizure into two broader categories, that is focal onset and generalized onset seizures. Now we will address the second question. How do I know if I have epilepsy? In other words, how a neurologist can diagnose a patient is having a seizure or not. The first question asks, when a patient presents with such event, we have to know whether that event is a true seizure or not. In most of the scenario, seizures occur in out of hospital setting, and the patient is usually unaware of the ictal and the post-ictal event. So we have to ask the history in detail about from the bystander, witness or the family member. They can only tell what happened during the event. We have to ask what happens before, during and after the seizure activity, so we can know the seizure semiology. We have to again ask about the risk factor and the predisposing factors, just like whether there is any family history of epilepsy was present or not, or whether there is risk of febrile seizure or not, whether there is any history of stroke or not, whether there is any past history of head injury or not, like this. In addition to the history, the other important things is that we have to do certain laboratory tests like a CT scan, a EEG test, electroencephalogram, or in some cases MRI scan to confirm our diagnosis of epilepsy. So these are the things from which a clinician or a neurologist can clinch the diagnosis of epilepsy. But to conclude, history taking is the most important, because this is from history alone almost all the cases of many cases of epilepsy can be diagnosed, because in most of the cases the laboratory findings are usually normal. Thank you. Namaste.